An exhausted Alice Atabo walks 30 kilometers not to the nearest health center or even mobile clinic, but at 9 months pregnant, she trudges on from her home in Nawoyawoi village, Turkana County, to the nearest traditional birth attendant. Now, the nearest hospital, Lodwar District Hospital, is 70 kilometers from her village. It will mean that she covers 140 kilometers on foot. And so many more pregnant women like her find their way to Napeikar village, where Paulina Ayenai attends to them. For Alice Atabo and other women confronted with the painful pangs of childbirth, the promise of free maternal health care remains a distant mirage.
Nimetoka huko asubuhi nikakuja hapa jioni kalala hapa kuona daktari.
Singa 20
Anatembea kilomita 20. Anasaidia kiwana anachindwa ndio anapeleka hospitali.
It is a different reality for 35-year-old Florence Wagidigi, worlds apart. She recuperates at the Pumwani Maternity Hospital, having undergone cesarean section owing to a pregnancy complication. But all else is forgotten as she looks at the blessing that is her 4-day-old infant.
Vivi hope handasa mulingi, and I'm happy. At least I'm going home with my baby.
A year ago, it would have cost her at least 6,000 shillings to undergo the surgical procedure at Pumwani Maternity Hospital. Today, she benefits from the government's directive to waive maternity charges at public health facilities.
They operated me, the baby is here, I've not paid anything.
Previously, before free maternity, we used to do 1,200, 1,300 per month. In Pumwani. We are now doing around 1,600, 1,700.
To the government's credit, the number of women that have over the last 6 months delivered in hospitals has increased to 66% from 44%, according to its statistics, translating to 900,000 women.
Previously, we are losing about 5,500 mothers every year. Now, with this intervention, the pregnancy-related illnesses and fatalities has dropped by 8%, meaning we are saving about 500 mothers every year. For the children, we used to lose 100,000 every year. Now with this intervention, we have seen a drop in mortality rate for children by 15% in the first 6 months. Now with that, it translates to saving the lives of about 15,000 children every year.
The challenge, however, is in ensuring medical access to all, including to women like Alice in remote villages.
We put a figure of 500 million shillings in the coming 1 year to buy mobile clinics.
The rolling out of free maternity services has also not been in tandem with the recruitment of more health workers.
We are supposed to have employed 30 nurses per constituency to ensure that the more mothers who go to the hospitals get better treatment. That has never been done. The 3.5 billion that was meant to be allocated for this function, we don't know where it is. The nurses are not employed.
We had budgeted that we would get about 9,000 nurses. However, because of devolution, there's been a bit of delay in terms of that process, but it will be fully effected from July this year.
In December 2013, health workers went on a 3-week-long strike. They demanded the creation of a health service commission to manage devolution. Scores of doctors resigned from public service to protest against being placed under county government's management.
A central body would be such as a Judicial Service Commission, which has brought a lot of positives for this country. An independent body, it can be central under the county government.
This is a constitutional issue. They thought that would have this HSC, much like we have TSC in education. But TSC, the education is not devolved.
Ensuring access to medical care for all, what is hoped will remain central in the health sector.
Healthcare budget to the counties alone, if counties are responsible for healthcare, must be 150 billion and beyond. And what do we need this money for? One, we need to almost re-equip all our hospitals. A second component of healthcare is the establishment of a national health insurance scheme that is devoid of corruption and fraud. Number 3 is human resource management. We don't have enough doctors, ladies and gentlemen.
So, number 1 is continue with the free maternity to make sure it's successful in the second year, so that we can see out of the 1.4 million mothers who deliver every year, at least about 1.2 they are going to hospitals. So free maternity is one area. Equipping the hospitals, the ultimate objective is to have universal health coverage. So with that, the next 2 years, I think you see a big change in the landscape.
Sally Mbilu, Sunday Live.